And we've already seen a virus that's spreading through some schools that just started, and it has some of the same symptoms as strep throat. Here to talk more about this and other important information for parents is pediatrician Karen Wheeler from IU Health Physicians. Dr. Wheeler, thank you so much for joining us.
Thank you.
So how can you tell the difference between strep throat and a virus, and now with pollen counts going up, really bad allergies?
Yeah, because probably most of your sore throats are virus, and probably your second sore throats in number is, as you said, from pollens. So strep throat is a small subgroup, which really will just have fever and sore throat. No runny nose, no itchy eyes, no cough, so that's one way you can kind of differentiate the two.
Now, do you typically see more appointments being made as soon as school goes into session?
Actually, I typically see a little lag. Right now, tons of physicals. School started almost everywhere by now. Visits really go down till about a month in, and then I think it'll be worse.
Any good advice for parents when it comes to germs? We just saw, of course, washing hands, the most important thing to do.
Yeah, and that was a great summary. I was listening along, agreeing with everything. I guess I would add, keep your hands out of your face, right? And that's a hard one for some little kids.
Of course, don't touch the eyes, try not to touch the nose and then the mouth. Just keep them down to your side as much as you can. Good luck making that happen. Yeah. Something that could really surprise parents are relatively new immunizations, and one of those is for high school seniors.
Right. Now, if you haven't seen your doctor in, say, 2 or 3 years for your high school children, you might be surprised when the school nurse says you need a second meningococcal meningitis, or MCV4 vaccine. And that recommendation has been in place for Indiana for 2 years.
And what if you have a kindergartner heading to school? There's a shot.
Yeah, so on the other end, we got another surprise. Came in about the same time, which is the use of an old vaccine for the hepatitis A virus. It's a set of 2, 6 months apart, that's now required for kindergarten entry.
So best thing to do is just check with your doctor, make sure you're up with those vaccinations.
If you're going about every year, you will have already taken care of these things.
And what about putting kids into sports? Because obviously a lot of those sports are starting, a lot of the practices have already happened. How can we keep our kids healthy? What do parents need to know?
Yeah, one of the things that kind of catches people is that they need that screening physical for their athletics, for the IHSA, before they start their practices or tryouts. Now, each year you need a new one. So if you didn't plan on coming in the summertime for those athletes, that winter physical doesn't count for the school system here.
So make sure that you make those appointments. And you said that's what you're busy with right now, not so much the sickness.
Right.
All right. Well, hopefully it remains a healthy year for you. We appreciate it, Dr. Wheeler. Thank you so much for coming in today.
Thank you.
Scott?